Hi, Dr. Riaz Agha here at Harley Clinic on Harley Street. I want to talk about recovery after a rhinoplasty, or a nose job as it's colloquially called. Rhinoplasty, the main thing that you can get afterwards is swelling. So for the first 7 to 10 days, patients are wearing a splint on their nose. After the splint is removed, they'll notice that their nose does look a bit swollen. If they've got thick skin, it tends to have more swelling. It takes longer to settle down. Thinner skin settles down more quickly and has less swelling. So it kind of is variable depending on the quality of the skin, the thickness of the skin. That swelling can really go on for several months and gradually tapers down. Most results you'll be formally reviewing at the sort of 3-month mark, 6-month mark and 12-month mark because of that swelling and the length of time it takes to settle down. In terms of pain, it tends to be most difficult in the first week, but it is well controlled by paracetamol, ibuprofen, codeine, tramadol, things like that. So that tends to control the pain through the first week. They generally don't have pain after that first week. Once the splint is removed, it's not really that painful an operation. In terms of exercise, I encourage people not to exercise for the first sort of 4 to 6 weeks. Let everything settle down, otherwise you could precipitate a bleed, or certainly you don't want to have a fall or have a knock on the nose which is just settling down, so you do not want to exercise too early. No contact sports for as long as you can avoid it. So, at least 3 months. In terms of showering, they're wearing a splint for the first 7 to 10 days, so it's difficult to shower because you'll wet everything, but they can go into the shower, wash the body, and then selectively with a sponge be careful to wash the hair and the face. So that is something they can be careful about and avoid getting the splint wet. In terms of sleeping, they should sleep on 2 or 3 pillows, head up, allow everything to drain, allow venous drainage to occur, allow the swelling to reduce, and that will obviously help with their pain control as well. Sometimes people may or may not need help with sleeping, like a sleeping tablet, but generally speaking it's okay.